Abdominoplasty versus laparoscopic surgery, drain or drainless. Yeah, to the point. That's what we like. Abdominoplasty versus laparoscopic surgery. Yeah, I don't really understand that. So laparoscopic surgery. Laparoscopic is keyhole surgery, where they put little tubes in and they look through a telescope and they do stuff inside. So they take your gallbladder out. You can do hysterectomies. You can do appendicectomies. You can take bits out of body cavities using minimal incisions. That's the good thing about laparoscopic surgery. It doesn't really apply to a abdominoplasty. You can't do a laparoscopic abdominoplasty because the whole thing about abdominoplasty is you're taking a big bit of skin out. You've got too much skin. And so putting a tube in and looking inside the bowel isn't going to help you take a big bit of skin out. So I'm not sure where you're going with this one, abdominoplasty versus laparoscopic surgery. The only thing I can think of, you might be thinking, is the divarification of the recti, the muscles, a laparoscopic muscle repair. Maybe that's what you're thinking of, which is a part of an abdominoplasty, bringing the muscles, the six-pack muscles together, is sort of an integral part of an abdominoplasty. But I would say the main part of an abdominoplasty is taking off the excess skin, the excess skin of the abdomen. And that is something which kind of by definition can't be done laparoscopically, because laparoscopically means with the telescopes. So yeah, that's not a comparison. Abdominoplasty versus laparoscopic surgery they're two different things. Drain or drainless depends on the surgeon. Personally, obviously, presuming you're asking me, I am drain. I'm a drain kind of guy. I think probably definitely the movement in terms of plastic surgeons is towards less drains, fewer drains, just in generally what we're doing. And I'm certainly using a lot less drains than I used to. I don't use any drains for breast surgery pretty much, except for a very big breast reduction and a capsulectomy. But a lot of surgery I'm not using drains anymore. But tummy tuck is one of the ones I still use drains. I do quilting stitches, which kind of closes down the space. The reason there's a question about drains or drainless is because when you do a tummy tuck, there's a space there, and the space can fill up with fluid, and so the drains will drain that fluid and suck it down. And but people don't like drains. They're uncomfortable. They keep people in hospital, because personally I don't like sending people home with drains, so it keeps you in hospital overnight. A lot of people are doing tummy tuck stay cases now. So they're using, the quilting stitches, glue, things like that. So I do use quilting stitches, and it might be that I would be able to not use a drain, but I haven't taken the plunge yet. Then I still use drains, and it is, people who use drainless techniques say they've got a low risk of seromas, but it's extremely low in my practice. And so, even though, I don't know, 8% or something, sort of whatever the quoted seroma rate is, I've had one that I can remember. I must have had more than one, but I've had maybe another guy with a bit of sweat. But, it's pretty low. Anyway, less than 1%. Yeah, that's why I still use drains. So I just use them overnight. So they come out the next day. And I do use drains simply because I want the drains are under negative pressure and they suck the skin flaps together, so make it that there's not a space there for a seroma to collect. I understand that it can be done drainless, and I know that a lot of very good surgeons do it very safely drainless, but I just worry about my seroma. Seroma is just a nuisance. It's not a disastrous seroma, to be honest. It's a bit of fluid collecting in the tummy, and you can come into clinic and drain it off, so it's not actually a disaster if you do get a seroma, but it's just that it's not a problem. Seroma is not a problem at all. I don't see it at all. And so I don't really want to change my practice, because it's just going to be a nuisance if we start getting seroma, especially if people live a bit far away and they have to come in. And sometimes seromas, you have to keep coming back for drainage, and it can be a bit of a nuisance, to be honest with you. So that's why personally I still use drains, but I do understand that a lot of surgeons are using drainless techniques these days. The other thing is, I think a lot of people kind of don't want to go home same day. So that benefit of the drainless, the fact they can go home same day, isn't kind of great, because I find a lot of patients would rather stay overnight, because a tummy tuck's quite a big op. So that's kind of it takes away from the benefit of Drainless, really. So I'm not really pushing the Drainless, because yes, it's not very nice having drains in, but if it's not very nice having seromas. So that's where I am.